Hello, it's Melissa Sweet here from Croakey. We're on a Croakey Go in Melbourne, #Navigating Health. Have a look. We're outside the Drummond Street Centre, and I'd like to ask our interviewees to introduce themselves, please.
Yeah, my name's Karen Field and I'm the CEO of Drummond Street Services.
My name's Gemma Mead, I'm General Manager for our Western region.
Kia ora, my name is Bex. I use she, her pronouns, and I'm the supervisor for a few programs for the youth community.
Fantastic. So, for people who are watching who don't know what Drummond Street is, could you just give us an overview?
Yeah, we're a generalist health and wellbeing service for all individuals, families, young people and children, but we also have a specialist focus on some of our marginalised communities who at times don't feel safe going into a lot of mainstream services. So we have a specialist LGBTIQ+ service and also work a lot with our refugee, humanitarian, entrant communities.
The focus today is on mental health for this walk. What are the mental health issues that you're looking at amongst your community that you're serving, communities?
I think the need to understand the way in which families think about mental health and therefore the language we use, particularly in our universal platforms, is really important when we're trying to get to children, young people and their families in order that we can respond to their needs early. And also, in particular, we know that those marginalised communities that we're talking about, they show up as having a greater burden of mental health issues, not because of something inherently in them, but often it's about the experience of discrimination, prejudice, etc. So that makes them much more likely to experience trauma and therefore have poorer mental health.
That's a really great reminder that, you know, on this walk we're talking about how to improve mental services for people who have mental health needs, but really mental health is created in the community, and often it's the community that is creating problems for people. Would you like to, elaborate how that fits within your ambit, or?
Yeah, I think Bex could certainly speak to the experience of young queer people and young people of colour.
So we found, especially working with the PHN as well, there is a resource that's going to be created specifically for young cutie POC. So from my research, it's actually one of the only ones that is kind of funded by an organisation that is a DIY or done outside of organisations. It's kind of showing that the progress of working with those communities is actually getting somewhere as well. The marginalisation is just sporadic within that, especially if you're not only just LGBTQIA but also a queer person of colour or multi-faith as well. The young people there, we found that a lot of young people don't tend to want to talk about their experiences until they're late teens, early 20s. So that's cultural limitations, it's family limitations, and obviously they're prioritising other marginalisations that they experience along with being part of the LGBTQI community as well. So we're kind of getting facts like that, which is helping us progress in connecting those communities a lot stronger in the future.
And what do we know about the demand for your services? Are you able to meet demand? I think you mentioned you're expanding.
Look, the demand, we are expanding, but that expansion, I guess, in a range of ways is off the back of the fact that we have a great track record around being able to provide a safe space for people to come. We have enormous emphasis on co-designing programs and services with the very communities. And part of that co-design is also creating lived experience workforces and ensuring that we have an affirmative employment policy to create a very inclusive workforce. That people from those communities want to come to agencies that look and feel like them, that understands those experiences of marginalisations, and these are the kind of critical things. I can tell you in the LGBTI space in particular, we have 7-month wait lists. And we, in a range of ways, can't meet that need right now. But certainly a PHN that privileges LGBTI community around their mental health needs is such a critical thing.
So is that your experience with the Northwestern Melbourne PHN?
Yeah, I think, as you know, we know good public health policy builds services where community goes. And when you're talking about marginalised communities, We know that they show up in a whole range of data as not going to services or not trusting services. So if you have a service that community trusts because they employ LGBTI people and people from different multi-faith, race, etc., they know that is important for them to feel trusted and safe. And so then if the PHN funds services that gets to those that they know are not showing up, it makes an enormous difference in terms of what you can provide and therefore good outcomes.
So you have a long waiting list. What do you think the situation is like around the rest of Australia? Are there other services? What do you have a sense of the national landscape or the wider Victorian landscape?
We certainly know from looking at population level data on who is most impacted by the burden of mental health that there is both universal need, we get that, but we also know that we need to think really innovatively around how do we get to some cohorts. Our trans, gender diverse, non-binary community has one of the highest, if not highest rate of suicide, for instance, and
communities in like regional areas as well.
Yeah, and in particular regional and rural areas. So thinking outside the square in the way in which PHN can particularly fill that local need, that local needs planning, and fill those gaps is absolutely important. And I'd really encourage all of them to think that way.
Great. So really a call to action to PHNs if they're not already doing this?
Absolutely.
Yeah. And we don't know whether they are or not.
I know that there's a couple, particularly within the national suicide policy investments that have been made within across the country around suicide, that there is a couple of projects that have focused, for instance, on LGBTI, but a couple out of a national landscape is a bit sad. And, we know that even people within the queer community, like our First Nations, LGBTIQ people, are even at greater risk. So, really encouraging those PHNs to think about that, closing the gaps in terms of addressing the kind of needs that aren't mainstream. And also understanding, I think there's a tendency in policy investment to mainstream everything rather than thinking about where do we locate our services, and if we've got services that are actually engaged with those communities, then build that capacity in them, and that's what this PHN has done.
Brilliant. Thank you. Now just to wrap up, I'll go to each of you and just your takeaway message. What's your message you'd like to give to people following this discussion?
Support QTPOC people, and young people are our future, so instead of making decisions for them, involve them in the process, because they're the ones that are going to follow through.
Fantastic, thank you.
To really involve and to listen to community in the way in which we design mental health services, to make sure that they're really responsive and reflect the people who are coming to our workplace, so that people feel that they can access the service.
Thank you. Final takeaway.
I just think being really smart. I think the PHNs have got a unique opportunity because of the data and their processes around planning to really identify those that are falling out of systems and system failures, and use that data wisely to make the right investments will make an enormous difference.